of the month, which is time in range, and is it a good metric, and is it going to change the surrogate markers of glycemic control that we have today, which is HbA1c. And to discuss this in detail, I have none other than Dr. Sunil N. Jain, who is one of the topmost endocrinologists in the country. He's the director of the Total Diabetes and Hormone Clinic and Hospital in Indore, and he's a very, very good and close friend. I'm in awe of him because he is one of the front runners of technology in diabetes across the globe. And the amount of people who go to him, doctors who go to him for training in technology and training in the way he has set up his institute, we all are followers of him. So it's a proud privilege to have him here. And we go to have a discussion with the technology man in India on something which is called as time in range. So, Dr. Sunil Jain, welcome to our show. Thank you so much for being here. Thank you so much.
Thank you.
So my first question to you, Dr. Jain, is that blood glucose has always been one of the markers for glycemic control and also for complications as such. Now we are looking at interstitial fluid glucose, and it is emerging because a lot of our organs are also in the interstitial. So what is your comparison between interstitial fluid glucose and blood glucose?
So one is a interstitial fluid glucose, which is bathing our cells, which we are measuring through the technologies which we call continuous glucose monitoring. Another area is the blood glucose, which is flowing in our arteries, veins, and capillaries. Now, the blood which is flowing in the capillaries, veins, and arteries versus interstitial fluid glucose. So ultimately, both these compartments have their own value. For example, when we use the word hypoglycemia, currently our definitions are based on the measurement coming from the blood. While in an interstitial fluid glucose, it may dip little lower in physiology also. And in addition, the changes which are happening in the blood are instant when the glucose is changing. While the same thing will get reflected in the interstitial fluid glucose after few minutes on an average around 8 to 10 minutes. That's what we call it as a lag time. So in a steady state, the blood glucose and interstitial fluid glucose will be more or less same. But when the glucose level are changing fast in the blood, we will see the same reflection in the interstitial fluid around 8 to 10 minutes later.
So, how do we measure interstitial fluid glucose? Tell us something about the available CGMs globally and what is available in India as well.
So, to measure glucose, whether it is in the blood or it is in the interstitial fluid, we know that there are enzymes which will work on the glucose, will create some electrons, and that's how we read the glucose, and that is what is the various technologies which you are using in the laboratory. More or less same technology, but with a very stable enzyme preparations have been coated around a platinum electrode. And this electrode, when it is placed in a subcutaneous tissue, can measure the glucose more frequently, very frequently. Like when we do a test on a glucometer, we put a strip, we put a drop of blood. Again, this strip is having a reagent which is acting with the glucose and creating a small current which is measured by the device. But that can happen only once. While when such an electrode is created, it is created in such a way that it is lying in the interstitial tissue and continuously measuring the glucose. Some electrodes measuring every 1 minute, some electrode measuring every 5 minutes, every 15 minutes, like different technologies. Now in the current era, we can measure glucose every minute in a continuous manner. That's how we can get a lot of information about what's going wrong in the biochemistry of a patient who is having diabetes. We insert a sensor in the subcutaneous tissue. This sensor is fixed on abdomen or arm, and now this is measuring glucose all the time. But earlier technologies were too cumbersome, and in last 20 years, there is a huge change. And now we have very small sensors like a 1 rupee coin. No wires, no cables. Just we put a sensor on abdomen or arm. And now this sensor is measuring glucose very frequently. And now we have technologies to transfer this data from sensor to devices. And that's how we can measure it.
Tell me, what would be the indications for a professional sensor like a Freestyle Libre Pro versus a Freestyle Libre for patients? What would be the indications for each?
So it's a very good question because now two technology
True.
with a similar way are available. So let me tell you how I use them because there can't be very clearly defined indication, but what I do in practice. So those of my patients who can take self decision, to whom I want to train how they can adjust their diabetes by looking at the glucose readings, like most of my type 1 diabetic patients. I put them on freestyle libre because they are going to take a decision there. In fact, every type 1 diabetic can be put on a CGM
True. True.
because that's how they can bring their glucose most of the time in a normal range.
Very true.
On the contrary, those patients to whom we know that we have to decide, they have a more or less fixed meal pattern, but they have little unpredictability in their glucose control, like many 60, 70-year age patients with multiple comorbidities. I put them on a CGM Pro, Freestyle Pro. They come to me after 7 days. I look at their reading, explain them, and I adjust their insulin doses.